Hypertension stands for high pressure. Hyper for high and tension for pressure. And where do we have high pressure? In the vascular system. We can diagnose hypertension by doing a blood pressure measurement. And here it's important that it is in the level of the heart and that the cuff is in appropriate size. For example, if you have a too small cuff, then it can cause an elevation of the blood pressure, a false elevation. You should not drink any coffee, or you should not smoke within the 30 minutes, at least within the 30 minutes, because coffee and smoking can both cause an elevation of the blood pressure temporarily. Sit quietly for at least 5 minutes. It's important because then you calm down and you are not so stressful, and therefore your blood pressure gets to normal. Classification. Normal is less than 120 and less than 80 diastolic. So systolic 120, diastolic less than 80. So two numbers to remember is upper limit 120, upper limit 80 to say normal. Everything above this is called prehypertension. Prehypertension is when you have 120 to 140 systolic or 80 to 90 diastolic. Everything above 140, everything above 90 is hypertension. So prehypertension is the gray zone. You cannot say that you are normal, but you cannot say that you have hypertension. You are in the gray zone. It means that you have a high likelihood of getting hypertension, and therefore it's important to start early lifestyle management. Stage 1 hypertension is when you have 140 above 260 or 90 to 100. So 160 to 100. So this is the upper limit of stage 1. The stage 2 is above these two values. So stage 2 is above 100 and above 100. Above 160 and above 100. Stage 2 goes up to 180, goes up to 120. So what I want you to remember now is these numbers. Normal goes up to 120 to 80. Prehypertension goes up to 140 to 90. Stage 1 goes to 160, 100. Stage 2 goes up to 180, 120. Because above 180 and 120, you have something called hypertensive urgency. And this is an urgent state, but you don't have any symptoms. So the patient comes in with no symptoms, and he have no clue that he have hypertension. Then we measure the blood pressure, and it says it is more than 180 and more than 120, and we get a shock. Okay, so this is the typical guy with a hypertensive urgency. He have a high confidence that he have no problems until the problems appear, and the problems will be emergency, because then you will have an organ damage. So the difference between urgency and emergency is the organ damage, and this is what organ damage looks like. So there was a guy who had a hypertensive urgency, no symptoms, and then we have a guy with a hypertensive emergency with many symptoms. And which are the symptoms? We will discuss that. There are organ problems. First, I want you to know this definition of white coat hypertension. White coat is a doctor's white coat. And why do the patient have a normal blood pressure at home and then a high blood pressure at the doctor's office? Because maybe he's stressed, he's afraid of doctors, I don't know. But this is a typical phenomenon of white coat hypertension, that the patient tells the doctor that I have totally normal blood pressure at home. And then when I come to you, I have a high blood pressure. Okay, the doctors have to then do a 24-hour ambulatory blood pressure monitoring, and this means that during 24 hours the blood pressure is measured during a whole day. This device is attached to the patient, and the patient is going home and doing regular activities, and then this device analyzes the average of the blood pressure, and in this way we can tell if the patient really have normal blood pressure at home. It's important that the diagnosis is made when we have many measures. So you cannot just measure it once and then start treatment. No, you need to have at least 2 measurements and actually more than that for at least 4 weeks to start therapy. This is true except when it's urgency and emergency. So whenever you have urgency, that is meaning more than 180 systolic and more than 120 diastolic, or with organ symptoms, then it's no question that we start treatment immediately. And what are the organ damage? What I talked about. The organ damage can be in the vascular system. So the main thing in hypertension is relating somehow to the vascular system, because the vascular system can affect almost all the organs. So this, you see, this is the vascular system. It can affect the brain, the heart, the kidneys, the aorta, and so on. Many regions. And if we start with the brain, in the brain we can have something called stroke. And there are different types of stroke. We have hemorrhagic stroke, which stands for bleeding. Hemorrhagic stands for bleeding. We have a stroke that is bleeding into the brain. And for example, why is this bleeding? You see, there is a small aneurysm there in the right picture. Aneurysm is a small pocket because of this high pressure that is inside the vessels. It's pushing this wall out into a pocket. And then eventually this pocket can rupture. And then we call an aneurysm rupture. And this is very dangerous because then we have a bleeding in the brain, and that can cause death. This is one type of stroke. The other type is ischemic stroke. When you don't have bleeding, ischemia is not related to bleeding. It's related to less blood going to the brain, less oxygen going to the brain. And as we know, the brain loves oxygen and the brain loves glucose. And glucose and oxygen is found in the blood. And if you have, for example, an embolus blocking the blood flow, then the blood can simply not enter into the brain region, and that brain region will die. And here we see the black colored dead brain. What about the eyes? In eyes, we will check with a typical ophthalmoscope. So the doctor comes with an ophthalmoscope, look into your eye with a fundus. So look into your fundus, and this is the picture of the fundus. This is what we see as a doctor in your eyes. And in hypertension, there can be something called focal arterial narrowing. In the right picture, I've shown that this regular sized artery is dilated, and then this becomes constricted. So there's less of flow there. And as you can see in the picture here, this artery is less in size than the bigger one next to it. And this is a focal arterial narrowing. There can be also something called arteriovenous nicking. And this is when an artery, the red color here I've drawn, and the blue is the vein, and these are crossing each other, and the artery is getting enlarged, thickened, and then it will compress the vein. And then we'll see a typical crossing of the artery vein, and this is called the arteriovenous nicking. Arteriovenous nicking, okay? Copper wiring, you have to just trust me that this is looking like a copper wire in the color of it. What about in severe stages? We can have cotton wool patch. This is an infarction in the retina, as you can see here. It looks like a cotton wool, okay? It's a whitish discoloration of the retina. And you can see many of these here. Papilledema is when this nerve is enlarged, the optic nerve is enlarged, is swelled, okay? That's papilledema. Retinal hemorrhage is a bleeding, so we have a bleeding into the retina here. Hard exudate, this is the whitish discoloration and hardening of the retina. These were the brain. What about heart? In the heart we can see typical coronary artery disease, and stroke together with this coronary artery disease are the most common causes of death in hypertension. So very, very important to check this. These are all the complications. The same thing here again. We have a block, and then the muscle region that should get oxygen is not getting it. And if muscle is not getting oxygen, then it cannot work. So it will be a muscle damage. It will die, the same as the brain died. Okay? And we can have something called left ventricular hypertrophy. And this is when the left ventricle, which you can see in this thickened left ventricle, is getting enlarged. Hypertrophy means enlargement. And this can cause congestive heart failure, because the reason why it gets enlarged is that the pressure is so high in hypertension. Okay? And the heart needs to beat and needs to work a lot to compensate for this, because the heart's function is to get blood to your whole body. But if the pressure is so high in the vascular system, then the heart needs to work so much, and then it gets thick. So it's like going to the gym unfortunately, when the heart goes to the gym, it can eventually die. Okay, and this left ventricular hypertrophy together with this myocardial infarction are the most common causes of death. What about aorta? Here's the aorta, which is coming from the heart and going to the blood. This is the artery that is making the heart. The function of the aorta is to get all the blood from the heart into your whole body. And if we have a problem with this, we can call it abdominal aortic aneurysm. We talked about aneurysm before in the brain when we had the stroke, but here instead of in the brain we have a pocket. You see a pocket? It can be in the thoracic region, then it's called thoracic aortic aneurysm, and here we have an abdominal aortic aneurysm when it's in the region of the abdomen. And this can also rupture and cause death. Aortic dissection is when the blood is entering into the wall of the artery. Okay, so you see it's cleaved endothelium here, and then it gets into the wall. That's dissection. What about legs? You have vascular system in your legs too, so you can have something called peripheral artery disease. This is a plaque, atherosclerotic plaque, and then the blood is not getting to your leg, and the leg can eventually die. Kidney, same thing here. You have a vascular system in your kidney, and then we get something called nephrosclerosis, because the kidneys have nephrons, and this is what filters your food and so on, and you filters your blood. And in this nephron you have arteries, afferent arteries, efferent arteries, and these arteries can get hardened. Sclerosis means hardening. So we have a hardening of the arteries of the kidney. And this is all a very, very dangerous complication, because this can cause renal failure, and without kidneys, you die. Laboratory. What can we see in the laboratory? We have to check urine of the laboratory to evaluate the kidney function. You have to check the blood and analyze the blood for example, cholesterols. We have bad cholesterol, we know the good cholesterol, and so on. This is causing atherosclerosis, and we need to evaluate these so we can treat the patients for any type of hypercholesterolemia, means high amount of cholesterol that can be seen. We know that diabetes is one of the comorbidities. They call it that because it's related to hypertension, and you need to check the fasting glucose, because glucose is high in diabetes here in the patient, and therefore we need to check cholesterol, glucose, and so on. And ECG, of course, because we need to see the heart function, so you will perform a typical ECG, 12-lead ECG, and then we can check for left ventricular hypertrophy, we can check for any kind of myocardial infarction, and so on. So these were the complications of hypertensive emergency. But what are the causes? Causes can be divided into primary and secondary. Primary is actually a fancy name for saying that we don't know what the cause is. So 9 out of 10 people have primary cause of hypertension, and it just means that we don't know what it is. Okay? Secondary is that hypertension is caused secondarily to another disease. And which type of other disease? Kidney disease, for example. Renal artery stenosis is one of the most common causes of hypertension. And renal artery stenosis just means that we have a renal artery going to the kidney, giving blood to it, but there can be plaques, there can be atherosclerotic plaques there that will make a constriction, that is stenosis of it. So if the kidney does not get in the blood, then it dies, as we saw in stroke, as we saw in the heart. Polycystic kidney is a very severe cyst-like kidney. So you see, poly stands for many, so many cyst kidney. Okay. Endocrine problems. These are the endocrine organs. We have adrenal glands, pancreas, thymus, thyroid gland, and so on. There can be problems in this, and different diseases of these different organs can then secondarily cause hypertension. Hyperaldosteronism is one of them. We have the adrenal glands causing hyperaldosteronism. The usual function of adrenal gland is to produce aldosterone, but in hyperaldosteronism, this is producing too much of aldosterone, and too much of aldosterone causes hypertension. What about Cushing syndrome? This is a syndrome of different types of symptoms that we can see, and this is also causing hypertension. One of the most typical signs are moon phase of Cushing syndrome, buffalo hump, we have weight gain, we have in the skin, we have stria, abdominal stria. The skin is very fragile, and the bones show an increased risk of fractures, and there's glucose intolerance and so on. This is a Cushing syndrome, and the most important for us now is to remember that Cushing syndrome can have hypertension. Pheochromocytoma. Pheochromocytoma, we have the adrenal gland here, and it's a tumor in the adrenal gland that can cause hypertension. And it's a typical episodic hypertension, meaning that you have higher hypertension, then it gets normal again. So it's like fluctuating, okay, depending on the tumor secretion. Hyperthyroidism is when you have the thyroid gland overproducing the thyroid hormones. And here we can see an enlarged thyroid gland where we call it goiter. It's a very, very big enlargement. Acromegaly. These are very, very typical signs of acromegaly. We have a very, very big jaw, strong jaw. We have periorbital ridge. As you can see, above the eyes, there's a real ridge. And then we have a big head. And there will be big hands, there will be big heart, big feet. And of course, in our presentation, we need to remember hypertension in acromegaly. Medications can also cause hypertension, and one of the most common medications are oral contraceptives. So women are taking it for preventing pregnancy, and this can cause hypertension. Decongestant, normal nasal spray, can also cause hypertension. Chronic steroids use can cause hypertension. Antidepressants, like tricyclic antidepressants, can cause hypertension. Non-steroidal anti-inflammatory drugs, those used for example, pain relief, fever, the typical ibuprofen, for example, these can cause all hypertension. And then we have the illicit drugs, cocaine or amphetamine, and these ones. Of course, hypertension is not the most severe side effect of cocaine. Of course, we can get death even if it gets a too high addiction of it. Vascular system, coarctation of aorta can be a typical cause of hypertension, and you see the indentation of the aorta, and because this is causing that the blood flow cannot really go through the aorta, then the pressure builds up and the left ventricle will get enlarged. Obstructive sleep apnea. So if you have a partner who is snoring a lot, then it's a typical sign of obstructive sleep apnea, and you need to evaluate hypertension in these patients. So treatment. First of all, we stop any medication that can cause hypertension. Then we do lifestyle modifications, because obesity is one of the most common reason or risk factors for hypertension. We need to attack this as soon as possible. Obesity is not just an aesthetic thing. It's not about looking good, okay? That's one part of it. The biggest problem with obesity is not that you don't look good. The biggest problem is all the diseases that comes with it, okay? Hypertension can be caused as a huge risk factor for it, at least for hypertension. So if you reduce the weight, then the hypertension will decrease. It's almost a linear correlation. So the more kilograms or the more weight you decrease, the more the blood pressure decreases. Exercise. There are different motivational things for patients, and this is just a funny picture showing it. Every patient needs a different exercise plan. You cannot give the same exercise plan to everybody. Some people can only walk. Some people can run. Some people can go weightlifting. So there are different modalities, and I cannot explain everything about exercise here, but you need to remember that you need to do exercise continuously. You cannot do it for 1 week. You need to do it for several weeks, for several months, for several years. It's a very long process. Diet is important, and one of the most important diets for hypertension is the DASH diet. And we will use whole grains. This is a bread showing whole grains. We'll use fruits and vegetables. a very, very nice picture of nice fruits and vegetables that we can eat. We will have low-fat dairy, like milk and yogurt, for example, and this combined with the fruits and vegetables and the whole grains is very good for the long term with lean meat, so you get the right protein level. So chicken and fish, for example, are very good. They are low in fat and they are high in protein. Salt needs to be totally reduced, or if not totally, then very, very low in amount. Alcohol, the same thing. If you don't stop drinking alcohol totally, okay, drink it, but remember, the more alcohol you drink, the worse it is. Okay, so please, if you want to drink alcohol, then don't drink more than one, maximum 2 glasses of wine per day. Okay, medications. What medications can we get? So if we did the lifestyle changes and it didn't work out, so it couldn't lower their blood pressure enough, then we start with medication. So don't start with medications immediately, only in urgency and emergency states. But otherwise, you start with lifestyle. If it doesn't work, then we come back to the doctor and we start with angiotensin converting enzyme inhibitors. These are the ones ending with pril: captopril, enalapril, lisinopril, ramipril. Remember that these medications can have a typical side effect of coughing. And if this happens, then we start instead with the angiotensin receptor blockers, because these have the same efficiency, same effect almost, and therefore it can be used, but it doesn't have coughing as a side effect. So if you have a coughing, then start with this one instead. And these are ending with sartan. So losartan, candesartan, valsartan. For example, if the patient is not getting better with one medication, then it's advisable to give a second medication. Calcium channel blocker can be the second medication together with the AC inhibitor. And we can divide these into dihydropyridines or non-dihydropyridines. The dihydropyridines are acting on the vascular system. For example, these are ending with dipine, like amlodipine, for example. And this with the vascular system. And non-dihydropyridines are acting on the heart. And these are, for example, diltiazem and verapamil. Okay? And let's say the patient is not getting better with two medications. What do? We give a third medication. Thiazide diuretics, for example, hydrochlorothiazide and chlorothalidone. The most important thing is not which medication we start with. We need to start with one of these four. Thiazide diuretics, calcium channel blockers, or angiotensin receptor blockers, or angiotensin converting enzyme inhibitor. So we need to start with either of these. The most important is not which one we start with. Most important is that we start any of these, and then we increase the dose and increase the number of medications if the patient is not getting better.